Losing weight is one of the more common health goals for people, but it's also one of the more difficult to achieve. Joining us to talk about why that is and maybe some contributing factors is Dr. Matthew Fourman, a weight loss surgeon for ProMedica. Thanks for being here today.
Thanks for having me.
Absolutely. So we're going to talk about metabolic health today. What is that?
Very good question.
He was like, how much time do you have?
Right. So metabolism is essentially the sum of all of the cellular processes in your body. So that's a big term. When we specifically talk about metabolic health, it's probably best to think about that in the context of what's called metabolic syndrome. Okay. So there's 5 things that really make up metabolic syndrome, and we'll go through them quick. So elevated waist circumference, elevated blood pressure, elevated fasting blood sugar, low HDL cholesterol, and high triglycerides. So the theme of that is blood sugar control, your lipids, and then your weight. And so that those 5 things have been sort of contributed to metabolic health. And so we kind of use those as parameters.
And that's why you have to get your blood work done on a pretty regular basis to know where your cholesterol is, to know where your glucose is. And that might give you an indication as to why you might be gaining weight or not being able to get it off. So what are so I'm guessing those are some of the factors then that contribute to weight gain.
Right, and really one of the underlying themes of all of those is insulin resistance. So we think of insulin as this substance that is just there to control blood sugar. And that's one of the main functions, but it does so many other things. And there is a very large portion of the American population that has insulin resistance and doesn't even know it because we don't typically check insulin. And so you've got this elevated hormone in your blood that is a pro-growth hormone. We don't even know that it's elevated, but it's really fighting our weight loss efforts. And again, we don't even know that it's there because we don't really check it.
Yeah, and can you check that?
You can. Yeah, and there's a couple ways to check it. You can get a blood insulin level, but one of the gold standards is a glucose tolerance test. So it's not something that's really commonly done because it's fairly involved, but we can actually test your body's response to a glucose and how the insulin responds to it. So there are ways to test for it, yes.
And this wouldn't just be people who necessarily have diabetes, type 1 or 2?
No. In fact, insulin resistance can be present for decades before we actually start to see a change in the blood sugar. And so we check blood sugars, but in essence, we've kind of been missing it for years because the blood sugar can be totally normal, but the insulin's high.
You said it's kind of involved to check it though. What kind of process is that?
So we can very easily check just a fasting insulin level, which is the first thing in the morning. And we have a cutoff. If it's up, then we know that you're probably insulin resistant. The glucose tolerance test is a little bit more involved. So you drink a very disgusting high sugar drink.
When you're pregnant, ladies, you know what you know what he's talking about. Yeah.
And then you check blood at 30, 60, and 90 minutes, and we can kind of look and see how your body is processing that sugar that you just took in. So it's an involved test. We don't do it a lot in the clinic except for pregnancy.
Been there. I did pass, but I did have to do the 3-hour one, I think, which was no fun. You mentioned hormones though too. What is PCOS and how does that affect weight? So
PCOS is polycystic ovarian syndrome, and it's actually the most common cause of infertility in females in the US. So the physiology is really complex, but in essence, insulin resistance is probably arguably the major contributor to that. And one of the manifestations, especially in females of childbearing age, is PCOS. So almost always, if you can correct the insulin resistance, you can improve fertility and improve the symptoms of PCOS too.
Right, and what are some of those symptoms?
So infertility is a big one. Irregular menstrual cycles. And then women can actually have cysts on the kidney, hence the name. But it's very uncomfortable and frustrating for young couples too because it's a major contributor to infertility.
So it's a lot of things to look at. But you know, what are some suggestions though for people who have these conditions, maybe insulin resistance, PCOS, what are some suggestions? What can we do? Help the people out.
Well, it's the stuff that is the hard things, right? Nutrition. And nutrition can be very sort of tribal. And so essentially decreasing your carbohydrate intake because carbohydrates really stimulate insulin more than the proteins and the fats do. Good sleep. That's one that we don't really talk a lot about, but poor sleep really can improve your, can worsen your insulin sensitivity. And then adding muscle. Muscle is the biggest sponge of glucose, and the more muscle you have, the more insulin sensitive you are. So those are three, simple things that you can do to improve your insulin sensitivity.
So maybe back off on the cardio and do the heavier weights.
Yep, or do both.
Or do both.
Do both.
Both are good because you want good heart health too.
Don't neglect the resistance training for sure.
Yes.
Yep.
Okay. So if people, if you're just getting started out though, just get started.
Absolutely. And that's where seeking the help of your physician or personal trainers can kind of help, because that's one of the hardest parts about exercise is, what do I do? Where do I start? And so getting some guidance on that can really help.
Yeah, so really if you're finding yourself, you're like, I'm gaining this weight, I don't know what's going on, my body's changing. First of all, get your levels and numbers and things checked to make sure everything is okay there. And then, maybe find yourself a good trainer who can help you pump up the iron.
Exactly.
Right?
Yep. But check your blood, because knowing what your biomarkers are is really important.
Okay, very good. Doctor, thank you for being here today.
Thanks for having me. Appreciate it.
Absolutely.